strategic and sustainable partnerships at national, regional, and international levels towards realizing sectoral priorities, including initiatives to address challenges on human capital development in health sector. Could you elaborate on specific successes achieved by the Ministry of Health through these partnerships in addressing human capital development challenges within the health sector? Karibu.
Asante. Thank you, Madam Facilitator. And before I start, let me acknowledge the presence of our Honorable Prime Minister and also our Honorable Minister. So, as you rightly defined what is human capital development, I will not go back to that, but in the health sector, what it means to us is about not only producing the numbers, but producing healthcare professionals who have the right skills, who have the right qualities, and who can respond to the current needs, but also who can bring an impact to the socio-economic development of the country. So specifically, what the government of Tanzania has done through the Ministry of Health, but also with other ministries, one is enhanced training. In terms of training, for the past 3-4 years, we've seen a massive investment in terms of training healthcare providers in specialization and super specialization. And this has led to the change in our curriculum, and I would like to cite specifically MUHAS, who are now producing super specialized healthcare providers in various areas. And some of them have trained outside the country. We are now seeing an increasing number of neurosurgeons, cardiac specialists, nephrologists, and those kind of healthcare providers who were not there before. And this is a massive investment that the government has done in terms of developing the human capital. But again, another thing that I would like to point out is once somebody has received the pre-service training, if you really want to ensure quality, that's not enough. You must provide them with on-job training. And in this regard, I'm very grateful to our partners, and I will specifically cite the US government, who supported the government of Tanzania to develop what we call the National E-Learning Center, okay, which is located in Morogoro. This center has been very useful in terms of providing on-job training, but also making sure that we do not see most of our staff leaving their workplaces to go for training, because they can receive trainings online. Another area is recruitment, capacity building, and quality improvement programs. This is also an area that the government of Tanzania has done tremendously well. We have quality improvement programs, especially for mid-level cadres. All of you will understand that close to 80% of our people, they receive their services in the primary healthcare facilities, where the workforce which is there is mid-level cadre. So we have this quality improvement program whereby our healthcare providers, they are continuously under training. And we have a number of facilities that have been equipped with training materials, but also facilitators that have been trained both in country and outside the country. And in this specific area, I would really want to echo our appreciation to the UN agencies, including UNICEF, UNFPA, Global Fund, but also Mkapa Foundation through the Mkapa Fellows Program. They have really worked with the government to make sure that the providers who are working in our facilities are always constantly renewing their skills and improving their competences. But I wouldn't end this forum without mentioning the President Samia Scholarship Program. President Samia Scholarship Program for the past 3 years has trained about 1,404 specialized doctors and super specialized doctors, both within and outside the country. When our Honorable Prime Minister was passing through outside there, he saw some of our partners who are supporting the government in medical tourism. You cannot embark in medical tourism if you do not have super specialized healthcare providers. So through the Samia scholarship program, we have now a huge number, and this has opened doors for patients from within the African region, but also Central Africa and Eastern Africa, to come and access services within our country. As I finish up, another thing that the government has really done well is the digitization of health services. Initially, it was very difficult for a common mwananchi located somewhere, let's say in Sumbawanga, to get specialized consultation. But now, through digitization of health services, we have what we call telemedicine. Telemedicine has been a game changer in this country, because right now we have CT scans, we have digital x-rays, and all those kind of equipments that are all digitalized. So once we have our specialists that are located in very few facilities, they can support healthcare providers who are in remote areas, okay? And what the government did was to train our specialists on how they can use technology to support other facilities that are in remote areas. And this has not only contributed towards human capital development, but it has also addressed one big challenge that we are facing, that is the inequality. Because it was like only people who are in urban areas can have access to specialized care. But now even those who are in remote areas, in the rural areas, they can get specialized care through telemedicine. Thank you.
Thank you very much, Dr. Magembe. Now we are going to Dr. Jimmy Onaz, the Permanent Secretary, Prime Minister's Office, responsible for policy coordination and parliamentary affairs. We understand that the Prime Minister is the office which is responsible for coordination of government business. And as an in charge of coordination of government business in Tanzania, what needs to be done to enhance collaborations for successful multi-sectoral partnerships in human capital development in our country? Karibu.
Thank you very much, Madam Moderator. I also acknowledge the presence of my boss, the Prime Minister. And your question is quite challenging, that because you are positioning me as the Chief Government Business Coordinator, and he is right in front of me here. So that is quite challenging. And also this session is so challenging more because I think he has never seen me discussing about his office in his presence. So, so you can imagine the seat that I'm sitting, and he's looking at me right now. But I'm honored that he allowed me to come here and discuss about how we look at the human capital in Tanzania, now specifically basing on the health sector. And you asked me what needs to be done. But again, I'll go back to the contribution that has been done by Dr. Magembe, that the kind of human capital that we need for our country, she mentioned and described very well. But I'd like also to add that we need human capital that can think independently, but also can learn. We also need human capital that is innovative, that can innovate within and without the sector, that is inquisitive and can embrace research and research results, but also that can integrate and interact with the global community, because we have also to share, but again, adopt technologies, as she said, but again, ideas and new innovations. We need human capital that is patriotic to our country, but again, that is whose knowledge and skill can also be traded, can be turned into commodity in terms of the professionals, but again, in terms of knowledge and skills that can be generated. Now, from the Prime Minister's office, we look at the health sector from the, if you like, the bird's view. We think of other sectors also that contribute to the health sector. We look at developing human capital that For example, if you have an ambulance driver, will excellently do his job to make sure that the ambulance services are excellent and provide the quality of the health sector that we want. But there are areas that we need to look at, particularly if you look at the framework of health sector in Tanzania and the coordination aspect, we have guiding frameworks that need to be implemented, to be worked upon, so that we can have a quality human capital in the health sector. If you go very high, you have, of course, the highest political will in this country, the support that we have, that has to be exploited, that everybody has to see that we have the president and the government that provides a push to make sure that health sector flourishes, advances, and therefore also health professionals and participants. Now, actually, let me contribute into this, highlight that it's not only the professionals that we are looking at. We are looking at also the participant, other associates that make the health sector successful. As I said before, if you look at logistics sector, also contribute to the health sector, education, security, and the like. And what we want is that each and every sector, from a very high level, contributes well and effectively to the health sector. But there are programs that need to be implemented. I know that in the health sector there are some strategies, policies, and the like. In the Prime Minister's office, for example, we coordinate the nutrition initiative countrywide, and we sit in that level whereby we look at each sector, making sure that it contributes effectively and its right share to make sure that our people are healthy, eat healthily, and we have, of course, healthy people. So we have a national multi-sectoral nutrition action plan in which we have different and various participants. I'm sure that some of them are sitting in this forum here today, and they have a duty in there. So in that framework, we coordinate and urge each particular stakeholder to ensure that the health sector performs excellently. Now, let me go back, for example, the mobility aspect, transportation. We also have security. We have the professionals in this health sector, but again, we have an education sector. It also has a duty in making sure that nutrition is achieved in our country. But again, there are other aspects that need to be considered. One is engagement of stakeholders. Now, who are the stakeholders? The stakeholders, you mentioned, moderator, the entire society. Our people have to be engaged to ensure that they also participate. But the government itself, of course, we have the Minister here for Health and the entire sector, but private sector. We have seen in our country that we have hospitals that are owned by the private sector. They are also contributors in the success of health sector in Tanzania. But again, the academia. These are the people we rely upon in conducting research, innovating, but again, sharing the information that is coming out of scientific research with the community and the global community at large for ensuring that the health sector is also well informed. Development partners are also important in this area. Now, the key aspect in here is the engagement of all stakeholders. As we coordinate the government, we also coordinate the private sector, the development partners, the citizens themselves, and partner states, for example, in East Africa and SADC. These are the areas, some of the areas that need to be worked upon, and making sure that are all contributing well to the human capital in the health sector. Possibly I'll get more time to elaborate further in the future. Thank you very much.
Thank you very much, Dr. Yonazi. The next, we go to Mr. Godwin Semunyu, Head of Corporate Affairs from National Bank of Commerce. We understand that National Bank of Commerce has been supporting business model initiatives to enhance employability of medical professionals and access to quality of care to the communities. Can you share with us what are these models and success made so far?
Thank you, Ben. I'll also acknowledge the presence of Prime Minister Honorable Majaliwa, who is the patron of health. Ladies and gentlemen, only 2 days ago, Prime Minister ran 42 kilometers in NBC Dodoma Marathon, of where we were collecting money. The funds are going straight into the health basket. Yes, so to come to your question, NBC Bank faces the health sector in 2 areas. First, as a commercial bank, we provide facilities to develop different commercial areas. Like we have commercial asset financing, of where medical practitioners can have credit facilities that are security free to develop their hospitals and clinics. I'm saying this is security free. It means the machine that you take credit for will stand as security. Also, we are partnering with strategies to offer health insurance to the market. Another area that NBC Bank participates is as a corporate citizen. As a corporate citizen, the bank sets 1% of its annual profit into CSR. 3 main areas that we are very proud of is our partnership with the Ocean Road Cancer Institute, of where we participate in cervical cancer awareness campaign. For the last 4 years, we have contributed more than 700 million, of where more than 50 women have been screened free. And we have more than 3,000 women who were screened with different stage of cancer are now treated free at Ocean Road Cancer Institute. I'm happy to report that we have 100 women who are now cancer free and they've worked home. Another area that NBC Bank is participating is a midwifery scholarship, of where we're in partnership with Benjamin Mkapa Foundation, Madam Helen. Last year, we provided scholarship for 100 midwifery. This year we are going again. We'll have 200 scholarships. Our aim is to be part of the change that we want to see in our society. Through midwifery, we can save lives. At NBC Bank, we believe that women should not lose life while giving life. So we're pushing that area. Another area that we're participating is our partnership with Minister of Health. From this year, because we are the main sponsor of the NBC Premier League, so we are participating in Mtuni Afya campaign, of where we're sensitizing active lifestyle. Our aim is to use the biggest platform in the country, which is the NBC Premier League, to sensitize about health lifestyles, practicing and to go away with non-communicable diseases. So NBC Bank is proud to say we are the #1 champion and #1 partner in the health sector. Thank you, Ben.
Thank you very much. Now we go to Professor Nakanjoko. Professor, being positioned to the entity where rich proven evidence are harnessed, can you share examples of successful regional or international partnerships in East Africa that have transformed the human capital development in health or other sectors? Karibu.
Asante. All protocol observed, ladies and gentlemen, and I'd like to first of all appreciate you for inviting me and Makerere University to this important event. I congratulate you upon this meeting. In regards to the partnerships, regional and international partnerships that we've had, I'll start by just giving a snapshot of the different types of partnerships that we have harnessed to contribute to human capital development in East Africa. These are multilateral and bilateral organizations, partnerships with academic and research institutes, partnering with non-governmental organizations and community groups, partnering with the private sector and industry, ministries of health and other governmental organizations, but there have also been disease-specific partnerships, For example, you've heard of the COVAX and other COVID and HIV-related partnerships to respond to disease entities, and other strategic partnerships to respond to specific problems. And these have been successful. I'll give just a few examples to illustrate that fact. For 10 years, we have been collaborating on the Afia Bora Consortium for Global Health Training. And this included 5 universities in Africa and 4 universities in the US. It was funded by the National Institute of Health of America. And in Tanzania, MUHAS was part of this partnership. For 10 years, we trained over 200 health workers in global health leadership because we knew that the next generation needs global health leaders. And many of the trainees on this program are taking up leadership positions in health. In Tanzania, for example, the Deputy Vice Chancellor of MUHAS, Professor Bruno Sungia, was part of this program, training in leadership, and he's now leading a big institution in the country. We have several health workers in different institutions, including the Registry of Nurses in Tanzania here. So these have been successful in training leadership. And they trained collaboratively by going to the different partner institutions through a 1-year experiential program to train on the job as leaders. We also have a regional partnership with the Africa Research Universities Alliance. This is a consortium of 18 research-intensive universities in Africa that collaborate together to promote training, and this is not only in health, multi-sector training at graduate level. And recently, this network has partnered with the MasterCard Foundation, and MasterCard is funding this network of institutions in Africa to train 1,000 PhDs annually. So these are going to be registered in African institutions, member institutions, and MUHAS and University of Dar es Salaam are part of this network, so we contribute to these 1,000 PhDs in Africa in the next 5 years. I'll also talk about the ADAPT One Health Network for building capacity for antimicrobial stewardship in sub-Saharan Africa. As you may know, we have an emerging epidemic of antimicrobial resistance. And it is estimated that by 2050, we will have more than 4.5 million people dying of antimicrobial resistance. Today, the people dying of antimicrobial resistance related illnesses are more than those dying of HIV and malaria, which are the largest epidemics that we know about in this setting. So this is a network of another 8 African countries funded by the GIZ in Germany to build capacity for antimicrobial stewardship, work with policymakers, and train health workers to prevent, predict, and manage this emerging problem. I'll also briefly talk about another partnership that we had. This is training health researchers into vocational excellence, the Thrive. This was established in 2009, funded by the Wellcome Trust, and this is also a collection of academic institutions in East Africa. For example, KCMC is part of this. The NIMRI Mwanza Research Center is part of this, together with other institutions in East Africa and 2 leading institutions in the UK, University of Cambridge and the London School of Hygiene and Tropical Medicine. And this has been very successful in building capacity for world-class training research programs in East Africa. Of course, together they have produced over 300 publications, and many have impacted healthcare. Have also supported IT infrastructure in different institutions, particularly those that were stricken by regional distress, for example, University of Rwanda and Gulu University. So these are part of this network, including ICIPE, the International Center for Insect Physiology and Ecology. So these are some of the many successful networks that we have had regionally, and we continue to have them because we believe that for us to face the emerging challenges to global health, we need to partner, we need to collaborate, and we actually practice the African saying that if you want to go fast, go alone. But if you want to go far, go together. So there are many, many opportunities for us to collaborate and go together in addressing the healthcare challenge, which is our common enemy. To partner together, we must have a common vision to address a common enemy. And this is what we have to do in Africa. Thank you.
Thank you very much, Professor. I've been informed that our time is up, so I would like to take this opportunity to thank you, our panelists, for your expertise and willingness to share your knowledge and experience, and to all of you, ladies and gentlemen, for listening and your active participation. Before I wind up, I should say the discussion we have had today underscore the urgency, need for collaboration at all levels to build resilient and sustainable health workforce. Let us carry the momentum of this conference forward as we work together to achieve our shared vision for better health outcomes. Thank you very much and have a nice morning. Thank you.